Hello, and welcome to today's webcast, Joint Gut Connection, is Microbiome Health a Factor in Psoriatic Arthritis? My name is Bev Bromfield, and I'll be your moderator for today's presentation. Before we start, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your computer desktop in the upper right corner. You've joined this presentation using your computer's speaker system by default. This means if you hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, select Use Telephone in the audio pane, and the dial-in information will be displayed. You'll have the opportunity to submit questions to today's presenter by typing into the questions pane on the control panel. You can send your questions in at any time during the presentation. We'll collect these and address as many as possible at the end of Dr. Manison's presentation. Before I provide information about the foundation, I'd like to acknowledge our sponsors who are supporting PsA Action Month activities, which includes today's presentation. A sincere thank you to Amgen, Bristol-Myers Squibb, Celgene, Lilly, and Novartis for their support of today's webinar. Since some of you may be new to the foundation, here's a little background about who we are, our mission, and what we do. In 2014, the National Psoriasis Foundation developed a strategic plan which drives everything we do as an organization. To achieve our mission, the following goals were identified: accelerate discovery to cure psoriatic disease, improve health outcomes, achieve goals to help reach our mission, whether it's being involved with an event or becoming a volunteer. By attending today's program, you've already taken a step towards expanding your knowledge about psoriasis and psoriatic arthritis and a better understanding of what it means to live with psoriatic disease. If you have psoriatic disease, you can help accelerate efforts towards a cure and a greater understanding of the disease by participating in the NPF Corona National Psoriasis Patient Registry, which is the largest independent observational registry of psoriasis patients in the U.S. This registry represents a network of dermatology clinics that collect and study patient health information, allowing researchers to compare the safety and efficacy of psoriasis treatments, better understand conditions that are related to psoriasis, and explore the history of the disease. You can share your experience with researchers about what it means to live with psoriasis and psoriatic arthritis by participating in Citizen Scientist. Answer questions and view your data along with over 4,000 participants. Data is used to help researchers gain a better understanding of the disease. To learn more and participate, visit the websites listed on the screen. We continue to improve health outcomes through our Patient Navigation Center, the world's first personalized support center for people impacted by psoriatic disease. The Foundation's Patient Navigation Center is available to help you find physicians, treatment information, navigate insurance issues, access support through our one-to-one program, and more. Contact us at 1-800-723-9166 or visit psoriasis.org/navigation center. To achieve the Foundation's goals as mentioned, please support our mission through donations or by participating in local Team NPF events near you. You can learn more at psoriasis.org/donate or teamnpf.org. On behalf of the National Psoriasis Foundation, thank you for attending today's webinar, where you'll learn more about psoriatic arthritis and an overview of the human microbiome, the role of the microbiome in psoriatic disease, ongoing research in the emerging field of microbiome health, and how such research could lead to new treatment options and a potential tool for diagnosing psoriatic arthritis, resources to help gain a better understanding of psoriatic arthritis. Now I'd like to introduce you to our speaker, Dr. Julia Manison. Dr. Manison is a postdoctoral research fellow in the Division of Rheumatology at New York University School of Medicine. Dr. Manison is currently conducting research on the impact of the microbiome in spondyloarthritis, particularly in psoriasis and psoriatic arthritis, under the mentorship of Dr. Jose Scheer. She will mention particular research she is conducting towards the end of her presentation today. Additionally, Dr. Manison is a past recipient of an NPF Early Career Research Grant. Articles she has published recently includes involvement of T helper 17 cells in inflammatory arthritis, depends on the host intestinal microbiota, effects of fatty acid supplementation and modulation of gut microbiome, and T regulatory cells in health and psoriatic disease, and more. It's my pleasure to welcome Dr. Manison, who will provide the latest information around the microbiome and current research. Please welcome Dr. Manison.
Thank you so much. So I have no financial relationships to disclose related to this presentation. And I'm just going to first start with a quick intro into psoriatic arthritis. Psoriatic arthritis is a chronic inflammatory arthritis that is associated with skin psoriasis. It is estimated that the prevalence of psoriatic arthritis in the United States is up to 0.25% of the population. What's remarkable is that up to 30% of people with psoriasis develop psoriatic arthritis, and the typical age of onset is in the 30s to 50s. Men and women are affected equally, and in most cases, psoriasis precedes psoriatic arthritis by an average of 7 years, although in a minority of cases, it happens in reverse. Unlike other inflammatory arthritides, such as rheumatoid arthritis, in psoriatic arthritis, the primary site of inflammation localizes to the enthesis. So an example would be here and here. And entheses are actually sites where tendons and ligaments attach to bone, and this is demonstrated by the figure. Psoriatic arthritis is a heterogeneous disease, which can present with a number of clinical features. In the top left panel, shown here, we see an example of peripheral arthritis, where there is swelling in the small joints of the fingers. An example would be here, and here, and here, and here. Swelling can also occur in larger joints, such as ankles or knees. The top right panel shows an example of sacroiliitis and spondylitis, which is inflammation in the sacral joints, which are located here, and inflammation in the spine. The bottom left panel is an example of dactylitis, commonly known as sausage digit, where an entire digit, such as a finger or toe, swells up. So an example in this picture is you can see these two toes are completely swollen, and it's actually not in one joint, it's multiple joints within the toe. And finally, in the bottom right panel, this is an example of tendinitis, and specifically Achilles tendinitis, where you see here there's a lot of swelling at the Achilles. And this is a very common site of inflammation in psoriatic arthritis. Beyond the entheses, psoriatic arthritis can be characterized by other features such as skin psoriasis, which is an example here. It can also be characterized by nail dystrophy or changes in the nails. And here you can see in this picture where the nail comes off a little bit on the sides, as well as pitting. And here you can see these little dots, which are commonly found with psoriatic disease. Other things that may be less well known are inflammation of the bowel, and this is an example of inflammation in the colon or colitis. This picture shows a colonoscopy where you can see there are ulcerations within the colon due to inflammation. And another feature beyond the joints and entheses is uveitis, shown here in the bottom right panel. And that's typically presented with a red, painful eye. And this is an extreme example here. Other related conditions with psoriatic arthritis include metabolic syndrome, obesity, non-alcoholic fatty liver disease, cardiovascular disease, high cholesterol, diabetes, high uric acid, osteoporosis, and depression. And therefore, it is not surprising that this is such a systemic disease. As you can see, it not only affects the joints and entheses, it also affects other organs as well. There are several risk factors for developing psoriatic arthritis. On the left here are psoriasis skin types that are associated with developing arthritis. And here you can see scalp psoriasis, inverse psoriasis, where you can get at the belly button or in the buttock area as well, and nail disease. In addition, genes certainly play a role. And in fact, individuals with psoriasis who have first-degree relatives with psoriatic arthritis have 40 times the risk of progressing to psoriatic arthritis compared to the general population. Other risk factors include having severe psoriasis in itself, obesity, certain inflammation in the muscles and joints, and then specific biomarkers which we see in the blood. However, despite all of this, the transition from psoriasis to psoriatic arthritis is still poorly understood, and we are still unable to predict which individuals will progress from having psoriasis or disease in the skin to having psoriatic arthritis or disease in the joints and entheses. Apart from genes and clinical features, psoriatic disease is also characterized by perturbations in the microbiome. Now, the microbiome is a hot topic right now, but I want to give you a little bit of background so you understand what we're referring to when we say microbiome. Human beings are very complex organisms, and they're made up of both human and non-human cells. And the term microbiota refers to the symbiotic, commensal, and pathogenic microorganisms harbored by human beings. So these are both beneficial and harmful organisms. And they include not only bacteria, but also viruses and fungi. These microorganisms are located on the skin, in the gut, and on other surfaces. And the human microbiome actually refers to the collective genetic material of these microorganisms. Before advances in DNA sequencing technology, the diversity of the human microbiome was significantly underestimated. Microorganisms were identified using standard laboratory techniques such as growing bacteria in culture, an example of which is shown in this figure on the left. And many of the microorganisms could not actually grow in such environments and therefore could not be identified. So in the 1990s, with the advent of next generation sequencing technology, we were able to identify microorganisms without having to culture them. So this is a culture independent method. And with this technology, it is now estimated that the ratio of bacterial cells to human cells is approximately 1:1, meaning that we have just as many human cells in our body as we do cells that are made up from bacteria, viruses, and fungi. The microbiome begins its evolution from birth, and factors that contribute to its composition are how a baby is delivered, either it's vaginal or C-section delivery, whether a baby is breastfed, what diet people eat, medications that we take, including antibiotics, which can kill off certain bacteria, environmental exposures, especially in early life, and what viruses we have. When there's an imbalance of bacteria in a given community, such as the skin or the gut, this is referred to as dysbiosis. And this can also apply to a disbalance of fungi or viruses, except that right now most of the organisms that are studied are bacteria. This kind of dysbiotic state can lead to dysregulation of normal microbial functions. And these are not listed on the slide, but some of these functions include protection from pathogenic or harmful organisms that cause infection, digestion of complex carbohydrates, synthesis of vitamins and amino acids that humans cannot produce, regulation of fat metabolism, and shaping the development of the immune system. And when these functions are disturbed, this can ultimately contribute contribute to the development of disease, and particularly autoimmune disease, such as psoriasis and psoriatic arthritis. There are several studies that describe a state of microbial dysbiosis in skin psoriasis, and most of them focus on bacteria, but a few also have looked at fungi. The three papers that I've listed here are pretty influential in this topic, and they do focus mostly on bacteria. The top paper by Gao and colleagues showed that psoriatic skin has a higher abundance, meaning higher levels of Streptococcus, and lower abundance or lower levels of Propionibacterium compared to non-lesional and healthy skin. The middle paper by Phelan and colleagues showed that skin psoriasis has lower abundance of Staphylococcus and Propionibacterium compared to healthy skin. And the bottom paper by Alexeyenko and colleagues showed a higher combined relative abundance of Corynebacterium, Staphylococcus, and Streptococcus in skin psoriasis compared to healthy skin. So in other words, these papers basically show that there's a pattern of certain bacteria that are more abundant in psoriatic disease and psoriatic plaques compared to skin that does not have disease. Our lab, led by Dr. Jose Scher, has demonstrated bacterial dysbiosis in the gut of psoriatic arthritis patients. In fact, psoriatic arthritis patients have an overall decreased diversity compared to healthy subjects, and this is shown in the figure here on the left. In all of these figures, healthy subjects are represented by the color blue. Subjects that have psoriasis, so only skin disease, are represented in green, and subjects who have psoriatic arthritis are represented in red. In this panel towards the right, we can see subjects that had psoriatic arthritis actually had much lower levels of particular bacteria, and these are highlighted. It's Akkermansia and Ruminococcus. And in this bottom panel here, all of these findings were further characterized by lower levels of heptanoate and hexanoate, which are two medium-chain fatty acids that we find in stool, and they were much lower in patients who had psoriatic disease compared to healthy patients. There's currently no published data characterizing the skin microbiome in human psoriatic arthritis. However, our lab, in collaboration with the lab of Dr. Bonneau and his grad student Michel Badri, has preliminary data suggesting that bacterial associations in non-lesional, or rather healthy appearing skin, in subjects who have psoriatic disease have more similarity to psoriatic plaques compared to skin from healthy individuals. This is actually demonstrated by the figure here on the right. It's a figure looking at networks of bacterial associations, and the two networks on the left side of the figure, highlighted or outlined in red, these networks are generated from associations of bacteria found in the skin of patients with psoriatic disease. The top one is in lesional skin, meaning skin that had psoriasis, and the bottom one is non-lesional skin, meaning skin that appeared healthy, but it was still skin taken from subjects who had psoriatic disease. On the right of this figure, the networks represent associations among bacteria in subjects who were completely healthy and did not have psoriatic disease. So when we compare all of these associations, we see that the distance between these two networks is actually smaller than the distance between each of the red highlighted networks to the blue network. And that's why we believe that the signal is showing us that the lesional and non-lesional skin has more similarity than either of those compared to healthy skin. So what do these findings mean? They imply that microbial perturbations may already be present in non-lesional, healthy appearing skin of people who have psoriasis or psoriatic arthritis, even in the absence of clinically visible plaques. And we're currently in the process of validating and expanding on this data. And a lot of this research was actually supported by the NPF. Since microbes are partially influenced by our diets, what about diet and psoriatic disease? Well, obesity is not only a risk factor for psoriasis and psoriatic arthritis, it leads to worse outcomes. And interestingly, dietary weight loss has been shown to improve both clinical outcomes and response to treatment in psoriatic disease. And what about particular supplements? There's one meta-analysis that found that fish oil has the greatest clinical benefit in psoriasis compared to other dietary supplements. And several studies have also linked gluten intake with psoriasis. And this is actually of interest as patients with psoriasis also have a higher prevalence of celiac disease, which is characterized by sensitivity to gluten. However, results from these dietary studies related to psoriatic disease should be taken with a lot of caution because these studies were not identical and they weren't done in the same way. There are a lot of varying factors, including different study designs, different types of diseases and populations that were compared, different time spans for receiving supplements, different dosages of supplements, and unclear long-term effects of these supplements. In addition, these studies did not look at fluctuations in the microbiome, so it's unclear how this affects the microorganisms. And more research really needs to be done in this realm before true recommendations could be made, aside from the recommendation of beneficial dietary weight loss. What about prebiotics and probiotics? Well, let's begin with a few definitions. Prebiotics contain supplements that promote the growth of specific bacteria, and probiotics contain live beneficial bacteria. Evidence on the use of prebiotics and probiotics in psoriatic disease is not very robust, and there is actually very little evidence so far because there haven't been a lot of studies done on the topic. There's one small randomized control trial in patients with psoriasis that showed improvement in markers of inflammation, but did not focus on the clinical outcomes. And there's another study that randomized 63 patients with active spondyloarthritis, which is a group of conditions to which psoriatic arthritis belongs. And these people were randomized to either an oral probiotic cocktail or placebo. And there were no differences in clinical outcomes measures between the two groups. And this is, I believe, the biggest study so far that's been done on the topic. So again, here we also need a lot more work in order to draw more definitive conclusions. Our lab actually currently has a study looking at the effect of coconut oil on the gut microbiome and the peripheral immune system of patients with psoriatic disease. And we're currently in the analysis phase of it, so we may have more interesting data coming out soon. So to summarize, psoriatic arthritis is a heterogeneous inflammatory disease that is associated with skin psoriasis and various other conditions. About a third of those who have psoriasis go on to develop psoriatic arthritis, but we currently lack the means to predict who these individuals will be. The microbiome appears to play a role in psoriatic disease, and further studies are needed to elucidate the extent and character of this relationship. And on this topic, our lab, again led by Dr. Jose Scher, is interested in answering a lot of these questions. And we currently have 2 studies looking at factors that influence the development and progression of psoriatic disease. And they're also looking at what's happening with the microbiome in the skin and in the gut. The first is called the Preventing Psoriatic Arthritis Study, which compares individuals with psoriatic arthritis with their first and second degree relatives who have skin psoriasis. And we're currently recruiting within our institution, but have also partnered with the NPF and are soon going to recruit more broadly. And the second is the Psoriasis and Psoriatic Arthritis Twin Study, which compares identical twins who have the same disease or have differences, meaning one is healthy and one has psoriatic disease. And this is done in collaboration with a Mid-Atlantic Twin Registry. And these studies are interesting because they're comparing genetically related individuals, particularly the twin study. So because we can take genes a bit out of the equation, we can really focus on what other environmental factors are contributing to development and progression of disease. And one of the biggest ones that we're looking into is the microbiome. So to end my talk, these are the references that I alluded to in this presentation. And these are some of the people and organizations that I would like to thank, because any research is not done solo, it's done with a lot of collaboration. So I would specifically like to thank my mentor, Jose Scher, and other people that we've collaborated with, including Dr. Richard Bonneau, Michelle Badre, Dr. Jose Clemente, Dr. Korolov, and Dr. Carlos Zubeda. I'd also really like to thank the NPF for supporting some of the research presented here, but also supporting many other research efforts. And I'm really grateful for this opportunity to present some of it.
Great. Thank you, Dr. Madison, for providing a look at the microbiome and how dysregulation can contribute to the potential development of psoriatic disease. It's certainly an exciting field, and we look forward to seeing the results of your research. So it's now time for the Q&A portion of this webcast. If you have any additional questions based on what you've just heard, please submit them now through the questions panel on the attendee interface. We'll attempt to answer as many questions as possible in the remaining time. Dr. Madison, one of the questions that came up is, are there plans to study microbiome of people with psoriatic arthritis, like the recent Nurses to Health study by Harvard?
Yes, so currently there are very few studies looking at the microbiome specifically in psoriatic arthritis. A lot of studies that have been done have actually focused on skin psoriasis. And one of the main studies that looked at the microbiome in psoriatic arthritis is actually Dr. Scher's study, which is published in Arthritis and Rheumatology. And some of the main results I presented in this talk. But our lab is now really focused on actually comparing people who have psoriasis and looking at their microbiome, but specifically comparing it to people who have psoriatic arthritis. And in general, it's very interesting to study the microbiome specifically in psoriatic arthritis because, as I mentioned before, one of the clinical features of this disease is inflammation in the gut. So whether it's clinical, meaning you can see it, or subclinical, that you can't necessarily see it on exam or colonoscopy, but there's still something going on there. And that certainly would, we think, affect the bacteria and other microorganisms there. But it may be a little bit of a chicken and egg issue where is it their inflammation because there's already differences there, or is there differences in the microorganisms because there's inflammation there? So we're definitely looking into it, and a lot of the studies that we're doing now are focused on specifically on psoriatic arthritis.
Here's another question. Are there now home testing for the microbiome? The science seems limited. Do you feel like they are beneficial now?
Yeah, so a lot of, at this point, the field of studying the microbiome is still relatively young. So most of the things that we find, and not just in psoriatic disease, but in other conditions, are correlations, meaning we see that there are changes that are happening and we correlate them with what's happening with the disease or other parameters. But many of the studies are, when the microbiome is looked at, are looked at in aggregate. So with compiling a lot of the samples together to see if there are any specific patterns. So I don't think at this point we really know, especially for psoriatic disease, like you have this bacteria and that's good, or you have this bacteria and that's bad. It's still in the process of discovery at this point. So I'm not sure It would be interesting to see what's going on with one's microbiome at home, but I don't know if you could really draw many conclusions from that.
And you started out by talking about psoriasis in general. A question here asks, will mild psoriasis advance to psoriatic arthritis?
That's a great question. At this point, we do know that about a third of people do advance from having psoriasis to having psoriatic arthritis. And typically, the clinical risk factors that have been identified are more severe psoriasis and certain types of psoriasis, like I mentioned, in the scalp and the nail, and inverse psoriasis. But again, that doesn't mean that someone with mild psoriasis cannot advance. What we're really interested in finding out now, I think, as a community of, as doctors, and I think patients as well, is will we be able to predict when someone comes to the office and says, okay, I have this, do you think my disease is going to get worse? And that's what we're really trying to figure out how to determine, because you can imagine if we're able to do that, then the hope is that we would be able to intervene at an earlier stage and prevent the progression. But right now we don't know, so we can't really tell anyone, okay, you have psoriasis, we know that you're going to progress, or you have psoriasis, we know that you're not going to progress. The focus of a lot of our studies as a community, and specifically in our lab with the two studies that I mentioned towards the end, we really want to hone in and figure out, what are the factors that drive progression. So hopefully more to come in the near future.
Great. It's good to know that there's hope for the future. Switching gears a little bit, let's look at some of the nutrition-related questions. We have one here that talks about supplements. They'd like to know what ordinary foods can they eat to change or improve the gut microbiome?
I can't answer about specific foods. We do have a study going on looking at coconut oil and how the effect of coconut oil on the microbiome and on disease outcomes. So hopefully we'll have some data soon as well. But in terms of food, I think that the main thing from literature review seems to be someone is overweight, then it seems like dietary weight loss helps with disease outcomes. But in terms of specific food to eat, in general, I think a balanced diet is the way to go. And at this point, there isn't any specific food recommendation that I can make in terms of, you eat tomatoes and that changes your microbiome. I think it's really a combination of a lot of factors, not just food, but it is important to keep things balanced and try to eat healthy.
Since you mentioned prebiotics and probiotics, a question here asks, what steps should I take to heal my damaged gut? What about probiotics?
Yeah, so as I had also mentioned in my talk, people who have psoriatic disease, this condition is associated with gut inflammation. So if that's the reason that the gut is inflamed, the best thing to do is really treat the systemic disease, and that may be taking medications. In terms of prebiotics and probiotics, unfortunately, there really aren't any robust studies on this. So at this point, there's no magic pill that you can buy over the counter and take and improve gut health. And the other thing that people should be cautioned with is that a lot of these supplements, or actually all of these supplements, are not regulated by the FDA. So sometimes you may not actually be getting what you think you're getting in these supplements. So first off, we still need to do a lot more research to kind of hone in on what is beneficial and what's not. And secondary, it would be important to make sure that even the supplements that are being taken, we really know what ingredients are in them. And right now, we don't really have that guarantee. At this point, cannot recommend a specific prebiotic or probiotic, but I do recommend treating disease if the inflammation in the gut is related to having psoriatic disease.
Okay, great. Are there any clues or indicators that would lead you to deduce that the gut isn't happy?
some indicators that the gut isn't happy could be that you're actually, especially if it's related to psoriatic disease and you have inflammation there, there may be symptoms. So, if it's really severe, there could be bleeding, you could have diarrhea, basically abnormal gastrointestinal symptoms. So if that's the case, it's really important to have that evaluated.
And you had mentioned earlier about fish oil. Are there any specific kinds or preparations of fish oil that are more or less effective?
So I don't recall offhand what the, which products that paper used. But I think, again, even with that, it's a pretty small study. And there were some conclusions, but it wasn't a very, a definitive conclusion. So what I would say is from all of this, that the study of all these dietary changes of prebiotics, probiotics, supplements, that there may be some signals, but they really have to be validated and investigated further, and also looked at in bigger populations and compared, in a similar way across a lot of centers to really kind of say, okay, this is really helpful. So I just presented it as something, that there may be a signal, but I don't necessarily want to say that it will cure disease at this point.
Okay, great. All right, one last question. If I reduce gluten but don't cut it out completely, will I still get some benefit?
You can try and see, if you feel better by reducing the gluten. What I had mentioned before is that it's actually interesting that there may be some correlation with celiac disease and psoriasis that's been seen in studies. In celiac disease, people have a sensitivity to gluten, so if you cut it out, then you definitely feel better. So there may be something to say about that with psoriasis, or if it's undiagnosed celiac disease. But in terms of cutting it down versus completely taking it out of the diet, it's possible to just try out and see what would make you feel better.
Great. Thank you so much, Dr. Manison, for sharing your expertise about the microbiome with us. We'll stay tuned for more information as your research progresses.
Thank you.
May is Psoriatic Arthritis, also known as PsA, Action Month. During May, the National Psoriasis Foundation will highlight access to information and education opportunities to help you live a life with less pain, avoid permanent joint damage, and to know what's possible. You can participate in activities at psoriasis.org/PSA-action-month. Receive a PSA flare tracker, donate to help support discovery of a PSA diagnostic test, or help participate in raising awareness about PSA. You can also access articles from the latest edition of PSA Active at psoriasis.org. In addition to today's event, upcoming webinars about psoriatic disease are listed here. Podcasts are also available through iTunes, Google Play, Spotify, or a feed service of your choice. You can also access podcasts at the website listed here. Next Tuesday's podcast will feature one of the world's renowned authorities on uveitis, Dr. James Rosenbaum. Contact the Patient Navigation Center to receive a PSA flare tracker, or if you still have questions, would like additional information about treatment options, finding a physician, or are having issues with accessing treatments, contact our Patient Navigation Center by phone, email, or Skype. Once you leave today's webinar, you'll receive a survey to provide feedback about the presentation. Tell us what you think. We value and appreciate your comments. I'd like to extend our thanks to our Psoriatic Arthritis Action Month sponsors, Amgen, Bristol-Myers Squibb, Celgene, Lilly, and Novartis for their support of today's webinar. Finally, you can access our webcast archive at psoriasis.org/webcasts. This concludes our presentation today. Thank you for attending.